Welcome to Hack Your Health with Dr. Nat, a transformative live stream TV show that brings wellness within everyone's reach. Each episode, featuring expert guests, delves into crucial topics like hormonal health, effective detoxification, and stress management through nervous system optimization. Gain practical insights into nutrition, supplementation, efficient workouts, and biohacking tools to enhance mental and physical health. So now, please welcome the host of Hack Your Health, Dr. Nat.
Hello, everyone, and welcome to Hack Your Health with Dr. Nat. I'm your host, Dr. Nathalie Beauchamp. Super excited, as always, tonight to bring you a guest who's very knowledgeable. She has written many books. So we're going to dig into her latest book. And the topic for tonight is, are you at risk for iron overload? And we're going to find out, if that's the case with my guest, Dr. Christy Sutton. So we're going to talk about what are the symptoms of iron overload. And I know we're going to touch into the anemias as well. We're going to talk about effective strategies to manage this. We're all about practical steps as we're both in practice. So it is very important for us to leave our patients with action step that they can take. And we're also going to touch upon genetic insight because there's, understanding the genetic factor behind hereditary hemochromatosis and what why regular screening is crucial and knowing the risk. So welcome, Dr. Christy.
Thank you. Thanks for having me.
Good. We're excited. And I'm going to brag about your book here. So we're going to go like this here. So this is Dr. Christy's book, The Iron Curse. Is your doctor letting high iron destroy your health? And you have another one, and I joked when we chatted, I thought I'd written big books, but definitely I've written big books as well, genetic testing. And of course, we're going to talk about genetic testing when we talk about the iron curse. So, Christy, I had listened to a podcast where you were interviewed. I think it was a biohacking podcast, and you had a pretty interesting story on how you ended up digging, because your background, like me, you're a doctor of chiropractic. You also do functional medicine, but there's quite the story on how you got digging deeper. So I'd love for you to share that.
Yeah, sure. So my personal history is that I have struggled with low iron because of Crohn's and celiac and just malabsorption issues. And so, in chiropractic school, this, we learn a lot about labs and iron, and we don't really learn about genes. We didn't learn very much about genes, but we learned a lot about labs. And so when I got out of school, I was interested in looking at iron levels. And I didn't really know that much about high iron because I was more focused on the low iron piece because that was my own personal struggle. So then after I got married to my husband, he had left some labs that his medical doctor had ordered. He left these labs that had showing he had high ferritin, which is a marker for high iron, high liver enzymes, which high iron can cause liver inflammation and high liver enzymes. And then he had some other labs that were out of range, like he had high hemoglobin and hematocrit and red blood cells. And so there were a number of different things that were not looking right. And I told him, you need to donate blood because that's what I knew was the best advice at that time. And it wasn't until I was writing my first book, that big blue genetic testing book, that I realized that the hemochromatosis genes existed. And not only did they exist, but my husband had one because I had done the 23andMe on him and then run it through that genetic detoxification report. And he indeed had a hemochromatosis gene. So we went through this kind of like odyssey of figuring out what was going on. We started with going to a gastroenterologist, And I went to the gastroenterologist and I explained to the gastroenterologist all the labs we had ordered and the gene that my husband had and how I thought that he had this hereditary high iron that was causing him to have liver damage. And the gastroenterologist dismissed all of that and did his normal workup and misdiagnosed him for a period of time with autoimmune hepatitis. And interestingly enough, the only reason that we quickly, by quickly, I mean like 3 months later, realized it was a misdiagnosis was because I was doing all of these supplementary labs to try to, because I wasn't convinced like that we were on the right track. And so I was doing all these supplementary labs and showed them to the doctor, which revealed like he doesn't have autoimmune hepatitis. It was a misdiagnosis. And then the doctor, the gastroenterologist was like, okay, he needs to go see a hematologist. He probably has, he thought he had this other condition called polycythemia vera, which is where you get high red blood cells. So we went to the hematologist and I, gave the hematologist the labs and the genes. And he was like, oh, this is simple, hereditary hemochromatosis. So that was an interesting experience because like my husband's primary care doctor ignored everything and didn't do anything at all, who had originally been ordering the labs that showed things were out of range. And then my husband, upon his own volition and his wife prodding him, went to the gastroenterologist who really missed the diagnosis and misdiagnosed him with something and only was backed out of that, forced to back out of that misdiagnosis because of, the annoying chiropractic wife that was kind of pushing for more info.
Yeah.
And then we end up in the right place, the hematologist, but it was a forced action. Like, the primary care doctor should have figured this out immediately and said, hey, there's an issue here. We need to do something. And and the gastroenterologist should have said, hey, you're right. This is hemochromatosis. But they both missed that. But the hematologist didn't miss it, which is great. But some, he's a good doctor. I have sent patients to hematologists and they have missed it. It's weird. So it's rare, but it does happen. So after, I don't know if you want me to go ahead and tell the story about my husband's pituitary tumor or do you want to wait? But
yeah, no, please go ahead.
Okay, so after we got my husband the hereditary hemochromatosis diagnosis, his labs were getting much better. His liver enzymes were coming down. Everything in the iron labs were coming down into the right range, getting into the right range. But in the process of me ordering supplementary labs, I had discovered that occasionally my husband would have slightly high DHEA or cortisol, which are stress hormones. And then they would come up slightly high and then they would like go back down to normal high, like high normal range, but normal. And so the DHEA was stubborn and it wasn't coming down and we didn't understand why. And so the hematologist said, well, I don't know why, let's go to the endocrinologist. So he referred us to the endocrinologist. And so I learned at this point in time that I would allow my husband to give his medical history, but then I would always have to like come in after and say, okay, this is the information that you need to know, because I learned my husband doesn't really know how to give a medical history very well because there's, that's kind of an art. So after my husband talked to the endocrinologist and everything, I came in and I said, I think my husband has Cushing's. And the endocrinologist said, no, he doesn't have Cushing's. He doesn't look like somebody with Cushing's. His blood sugar is normal. And then about 4 or 5 months later, my husband's getting a pituitary tumor removed because he has Cushing's. And this pituitary tumor is causing him to have high cortisol. And that's what Cushing's is high cortisol. So the reason that that's important is because it's like another example of me having to do something I shouldn't have had to do. And thank goodness we did it, but most people are not aware or able to do those things. But it's also important and relative to this iron story, because when I was writing this book about hemochromatosis, I realized that the pituitary gland gets damaged by high iron.
Mm-hmm.
There's certain parts of the body, and I know we're going to talk more about this later, how iron damages the body, but there's certain parts of the body, like the liver, that often gets damaged. But the pituitary gland, especially the anterior pituitary gland, which is where my husband's pituitary tumor was, often gets damaged by high iron, because high iron will accumulate there and then create like a lot of damage and oxidative stress. And that's an environment where you can get a lot of cancer cells to grow. And so I believe that this long history of my husband having undiagnosed hemochromatosis accelerated and contributed to him having this pituitary tumor.
Yeah.
And so
I think you're bringing a good point that, sadly for a patient, that they have to be their own health advocate, and sometimes, they may not have the expertise, sadly, that, your husband had the chance of, or the luck of having you being with him and advocating. So I'm guessing that's why you wrote the book, to give people the tools so they can read and then understand more. So let's dig a little bit. What is iron overload, and what and how can people get it diagnosed?
yeah, so it's okay. It's really pretty simple to answer those questions. But first, I need to say the reason I wrote the book is because after I went through what I went through with my husband, I got very savvy about looking at the genes in the labs, and I was realizing how many people had undiagnosed hemochromatosis. And I was realizing how much misinformation and bad information and gaslighting they were getting whenever they would go for a second opinion. Like, their primary care doctor would dismiss it and say, no, that's fine, or whatever. Or it was just being totally missed or ignored often. And so the reason I wrote the book is because I got so tired of having the same conversation of, you have a problem with high iron and you have this gene and you need to address it. And then patients often wouldn't listen to me. And so I got fed up with it and I wrote the book. But so back to your question is, what is hemochromatosis, iron overload, and how do you diagnose it? I think that was your question, right?
Yeah, it was. Yeah.
Okay. So hemochromatosis, iron overload, it's where you have too much iron. I mean, it's pretty simple. You have too much iron, and the labs that you definitively need to figure out if you have hemochromatosis are very simple to order. They're just often not ordered. And what you absolutely need as a bare minimum is you need a ferritin, which is like your stored iron, and an iron saturation. And if you have an elevated ferritin and an iron saturation over 45%, then you have hemochromatosis, iron overload. And if you have a hemochromatosis gene in addition to that, then you have hereditary hemochromatosis. If you don't have a hemochromatosis gene, you have non-hereditary hemochromatosis. It's pretty simple. And over 30% of the population has one of these genes. So we're not talking about something that's rare here. And most people that have hemochromatosis, they don't get diagnosed. It takes like 10 years if they do get diagnosed, and they have to see like 3 or 4 different doctors before they finally get diagnosed. And they have often had severe damage, often permanent damage to their health because of this simple thing not being diagnosed.
Yeah. What about the gene itself? Like, we're going to talk a little bit more into that, but where would someone go to get this gene tested?
So it's pretty simple. Now, personally, I have a lot of experience with 23andMe. So 23andMe is one way to do that. They test for 2 out of 3 of the hemochromatosis genes most of the time. Sometimes they test for the 3rd, but I think their newer chip just tests for 2 out of the 3 hemochromatosis genes. That's still better than most people. All 3 of the genes, you can just get the genetic test done through LabCorp or Quest. these are common genes to be checked for. They're just not being tested for. You can go to your doctor, your primary care doctor, and ask to have these genes tested. They may not want to order them for you, but that doesn't mean that you should.
And I'm in Canada here, so our healthcare system is different. So
Yeah. So then
um,
you'll have to go to more direct to consumer companies like 23andMe or
yeah,
Ancestry, or
yeah,
and then you'll have to look at the genes. And so there are so many ways. And if you want to know about the hemochromatosis genes, just ask those companies before you actually
yeah.
order their product, do you check for the hemochromatosis genes? And they'll
Yeah.
tell you yes or no.
Yeah, and for the people that don't know what 23andMe or Ancestry are, they're basically sites where you send, it was a throat swab, I believe, that is sent to the lab and it's tested and it's telling you your genetic. Most people will do it for, your ancestor, your lineage and so forth. I know personally I did it because my mom passed away of Alzheimer, and just before she passed away, I was able to test her. And funny enough, she did not have the Alzheimer gene. So that's a whole other conversation in epigenetic and lifestyle. But so these tests are available. And I know that you also have a platform yourself that can take the raw data from 23andMe and you import it in your platform and you can dig deeper into detoxification, correct?
Yeah. So the genetic detoxification is a program that I created that you download the 23andMe data, or you have to sometimes reach out to 23andMe and ask them to give you that data. And then you can upload that data to the genetic detoxification platform, and it'll give you a report that tells you about 300 different SNPs, and it'll give you your exact hemochromatosis genotype, and it'll give you your exact like Alzheimer's ApoE3 or 4 or 2. It'll give you MTHFR, and it has a lot of information on there.
Yeah. So, Christy,
So,
maybe some of our viewer may not know what SNPs are. So, do you mind explaining what SNPs
oh,
are?
right, good question. Yeah, so SNPs are just like where you have a single part in a gene that slightly changes. It just slightly changes, and that slight change can make ultimately change the way a protein looks, and then if that protein might not work as well, or it might work better than it did before. So the when I say the hemochromatosis genes, these are just different variations of that gene, and some variations are going to increase your iron absorption than others. So I can't really necessarily call it a genetic defect per
No,
se.
I'd say usually a little error in our code, and not to say that there's error. I don't believe we're
It's not
built.
always a bad thing.
Yeah,
Sometimes like
exactly.
it's good to have a change.
Yeah,
Change is important for survival. This is
yeah,
why
yeah,
there's so much diversity that we need. But
exactly.
I was gonna say, hemochromatosis can cause Alzheimer's disease.
Hmm.
So, did your mom have a hemochromatosis gene?
I don't know. I'll have to look. I'll have to dig
Yeah,
her data and look. So yeah. And
yeah,
so, what would be the symptoms? What did other than the pituitary tumor? But what symptoms should people
right,
look for?
right. So, pituitary tumors are not like a common, well-known problem related to hemochromatosis, but the most common, well-known problems related to hemochromatosis are related to the liver. So, like, there's a 200 times increased risk for liver cancer in people with hereditary hemochromatosis, because the iron really likes to store in certain parts of the body, and the liver is one of those parts of the body. And so, liver disease, fatty liver, high liver enzymes. Um, Iron also likes to go to the pancreas and damage the pancreas, so that can cause diabetes, Iron likes to go to the heart, causing cardiovascular disease, fatigue. It likes to deposit into the joints, causing arthritis, a lot of joint pain. It likes to deposit into the brain, causing bipolar, depression, schizophrenia, Alzheimer's, Parkinson's, you name it. It likes to go to the anterior pituitary gland, messing up all your hormones. And it likes to go to the ovaries and the testes, causing infertility, causing low sperm count, causing just, it can really ruin your whole health because your body doesn't have a great, other than through blood loss, which women have more than men for menstruation reasons, the body doesn't have a great way to get rid of iron. And so if you're really good at absorbing it, then your body's going to store it in places. And it's like a hoarder that's just constantly finding a way to put more iron in places that it really shouldn't be. And we need iron, it's essential, but too much can create a lot of damage and inflammation and what's called oxidative stress. And oxidative stress is what causes cancer.
So it's all the stuff that you're mentioning, the condition, the chronic inflammatory condition, those are all things that potentially patients get their lab, their liver enzyme is high. Yeah, don't worry about it, that kind of stuff. And even I find a lot of patients know that their ferritin is high, but this all doctors said not to worry about it instead of, continuing digging. So the way you're expressing all of those or explaining those symptoms, it can mimic or it can be the cause of a lot of other components that are, becoming their own diseases like diabetes and Alzheimer and so forth, but often definitely not looked at. So how, would you recommend to manage this? So let's say somebody gets their blood work, their ferritin is high, their iron saturation is high, they start digging and getting tested and so forth. What have you found that works for managing all this? It must be a pretty global and holistic approach, I'm guessing.
Yeah, so hemochromatosis, if you have hemochromatosis, especially if you have hereditary hemochromatosis, because if you have hereditary hemochromatosis, that means you have a gene that causes you to absorb more iron. This has to be managed for like the rest of your life, meaning that your iron levels need to be watched really closely so that you don't go too high or too low, but most likely so you don't go too high. And it's not like a death sentence. It's really quite an easy thing to manage, assuming you have somebody knowledgeable that is looking at your labs and guiding you. And the traditional medical way for dealing with hemochromatosis is primarily they use blood removal. Blood removal is a very successful way to lower iron. However, there are limitations to it. Some people cannot have blood removed because they don't have enough red blood cells or hemoglobin, or maybe for whatever reason, maybe they have like a heart issue. They can't have a lot of blood removed. But that is one tool. So in the iron curse, I have like 5 steps. Blood removal is one step. So whether it's through donating blood, a lot of people donate blood regularly and are protecting themselves unknowingly from having hereditary hemochromatosis because they're just donating blood. Other people are donating blood and they're making themselves anemic because they don't need to be getting rid of iron. And so like me personally, I've never donated blood and I never probably will because I tend to be on the lower end and I'm always kind of fighting to get higher, not, trying to get lower. So, but donating blood, step 1. Now, step 2 is there's diet. So diet, the most iron rich foods are animal products like red meat, shellfish, And these are the most absorbable forms of iron. While non-animal products like spinach have a lot of iron in them, it's not an absorbable form of iron. The most absorbable form of iron is found in animal products. So decreasing the amount of like red meat or shellfish can help if you're trying to get your iron levels down. But if you are not the type of person that is willing or able to do that, then there are some other things you can do to decrease iron absorption. So for example, you could drink tea or coffee while you're eating something with iron, because that will decrease iron absorption. You can do food pairing to like remove vitamin C rich foods from the same time that you're eating an iron rich food. Like maybe eating the orange with the steak is not the best food combination, because an orange has a lot of vitamin C and that will increase iron absorption. There are supplements that are very helpful for lowering iron. So we can talk about that part, but also looking at like what environmental factors might be causing you to have high or low iron. So for high iron, for a lot of men, they're taking testosterone, and testosterone will increase iron absorption. So, that's something worth knowing at least. And then the supplement piece, there are certain supplements that you can take that will bind to iron and lower the iron. And then those include curcumin, so like the extract of turmeric. And the nice thing about curcumin is that not only does it decrease iron, but it also is very good at decreasing inflammation. It's great at it's been shown to heal up the liver and the brain and the spleen, and really be protective against many different issues in hemochromatosis high iron patients. Another supplement that will decrease iron is alpha lipoic acid. It binds to iron. Silymarin, which is the extract of milk thistle, will bind to iron. And the nice thing about these things is that unlike the prescription options of iron chelators, which have a lot of bad side effects, all of the things I've just mentioned, they not just lower iron, but they also have other health benefits. So for like example, alpha lipoic acid can also lower blood sugar. And it's extremely important for having healthy nerve myelin sheaths and for having healthy nerves, period. If you have peripheral neuropathy, alpha lipoic acid should definitely be considered. Silymarin, which is the extract of milk thistle. Silymarin is excellent for helping to heal up the liver, but it also binds to iron and helps to protect you from high iron, but it also will heal up the liver and protect you from liver cancer. And, it's even been shown to make the quality and quantity of sperm healthier, so it's got a lot of antioxidants in it.
Do you mind explaining, just before we go to the break, what chelation is? So for people that may not know what that would be.
Yeah, so chelation is just where you're taking something that's going to bind to like a mineral and take it out of your body. So the medications that they use to chelate iron, what those medications do is they bind to the iron and pull it out. And they really only use those, like hematologists really only use those medications for people that have high iron that can't donate blood or can't have blood removed for whatever reason. And I think there's a really big missed opportunity here, because I think those medications should just not be used anymore. I think they should use the curcumin and all of the supplements that I outline in the Iron Curse, because there's so much research to show that they really help to lower iron in people that have high iron, and they have so many health promoting benefits.
Awesome. So let's keep that thought and we'll continue. We're just going to take a short break and we'll be right back.
Thank you.
In today's world, the flood of health information feels endless, but amidst the noise, two experts with over 50 years of combined clinical experience come together to help you with Smart Cuts, biohack your health span, cutting-edge protocols for greater energy and performance. Dr. Paul Sly, a beacon for athletes, weekend warriors, and those seeking to elevate their potential. And Dr. Nathalie Beauchamp, renowned for empowering individuals in their health journeys. Together, they've produced the book, Smart Cuts, Biohack Your Health Span, a protocol-based treasure trove packed with actionable steps. Journey through 5 transformative sections. Dive into sleep, hydration, movement, brain health, and even the secrets of longevity. Guided by their expert hands, unleash the best version of yourself. With over half a century of clinical wisdom and innovative protocols, reclaim your health and redefine your limits. Are you ready to embark on this transformative journey? Smart Cuts, available now.
And we are back to Hack Your Health with Dr. Nat. I am with Dr. Christy Sutton, and we are talking about her book, The Iron Curse. So far, we've talked about, her story into writing the book, and we've talked about what is iron overload. We talked about the genetic, and we are now talking about lifestyle. And Christy, I think you mentioned there was 5 steps in your book for people to manage that. We touch upon supplements. Are there any other supplements that you recommend?
Yeah. Okay. So another one is quercetin. So quercetin will help to lower iron absorption. So and quercetin has a lot of other health benefits. So for example, quercetin can decrease histamine. So a lot of people use it for allergies. People use it for COVID. One thing I didn't mention is that people with hemochromatosis are more likely to have infections, including like long COVID, because if you have high iron, then you're more likely, iron is kind of like a fertilizer for infections. So if you have high iron, you're more likely to have infections. So, quercetin's nice because it's been shown to be helpful with COVID specifically, but also it can help lower iron, which is great for people that have high iron. Not so great for people that are trying to get their iron levels up. So that's the other thing to be thoughtful about, because a lot of people unintentionally make themselves low in iron because they're taking a lot of like curcumin for inflammation or quercetin, or I've seen that a lot, is people unintentionally causing low iron because of diet or supplements or whatever. And then, even melatonin can actually help to lower iron also. And berberine, a lot of people think of berberine to help lower blood sugar and cholesterol, but it can also decrease iron absorption as well. And then in that chapter about the supplements, I have supplements that have been shown to protect from iron-induced damage, because iron creates so much damage. So lowering the iron is part of is an important and essential part of the equation. But another important and essential part of the equation is to protect yourself from damage. And that means like getting your antioxidants really high, like glutathione and vitamin E. So that's really crucial. So those are some of the helpful supplements.
Good. And any other lifestyle changes that people like you mentioned, the red meat, but is there anything else that people can pay attention to?
Yeah. So alcohol intake, like if you are drinking alcohol, that will increase iron absorption. Even like eating a lot of sugar can increase iron absorption. There are certain lifestyle things like exercise. If you exercise, that can lower iron levels. Assuming, some people with hemochromatosis are so sick that they can't just jump into an exercise program. So if you really have bad hemochromatosis, you need to be like managed by a doctor and hopefully get your iron levels low so that you have the energy and capability to go and exercise. But exercise can help lower iron. Avoiding altitude, like high altitude, if you do have hemochromatosis, if you have hemochromatosis and then you go to altitude, whether because you're like flying all the time or you're, trying to live at high altitude or climb a mountain or whatever, that's not a good combination, because the higher the altitude, the more damage that hemochromatosis causes. Yeah.
That's great. Any other tips? Because I'd like to touch on the anemias, because I think there are so many people, especially women, and oftentimes with the new patient intake anemia, and they're on iron supplements and so forth. So you worked, I'm sure, yourself out of the situation, or currently working on keeping your iron level. So what kind of advice would you have for people that have anemia? And there's so many types of anemia. We could probably do a whole show on the different types. But
totally. Yeah. So, anemia can really be a chronic issue too, because the things that cause anemia for a lot of people are often an ongoing issue. So for example, like females are often struggle with anemia because they're constantly losing blood through menstruation, especially if they have a really heavy period, or a really long and heavy period. Females also, having a child is an extremely iron depleting event. Even if you go into pregnancy with high iron, you will likely come out of it with low iron, assuming you're not taking iron throughout the course of that pregnancy. So I don't want to scare people from taking iron, because it's important and necessary for people that have struggled with low iron. So yes, like you said, there's multiple different types of anemias. If we're just talking about iron deficient anemia, then definitely you need to be taking iron. In some cases, I think the most common causes of anemia that I see, in addition to what I mentioned already, is digestive issues. So having like a GI bleed, you can lose a lot of blood with a GI bleed that you don't know about. And a lot of people do have GI bleeds, like aspirin, many people take aspirin. A huge side effect of aspirin is it causes GI bleeds. So that can cause chronic anemia. Also, not having enough stomach acid, either because you're not making enough. Like me personally, for a long time, I had low stomach acid and I didn't know it. And it made a huge difference in my health when I started supplementing with stomach acid. And a lot of people are taking medications to lower stomach acid, and those medications cause malnutrition issues. Like they cause nutrient deficiencies, including iron deficiency. But it's not just iron. You're not absorbing any of your nutrients as well. You're not absorbing your protein, your vitamins, everything. They're really a problem, the acid reducing drugs. And then a lot of people that have undiagnosed celiac disease or some other malnourishment issue in their digestive system, it's very common for them to have chronic iron deficient anemia along with other vitamin and mineral deficiencies that they may or may not be aware of and can't get over because they're just not absorbing things properly in their gut.
Mm-hmm. What type of ferritin level do you like to see for people?
Yeah, well, I don't really ever like it to go over 100. And if you have a hemochromatosis gene and you tend to err on the side of being higher, then ideally, I like it to be more around the 50 range, but never really going over 100. And if you have a history if you struggle with more the low iron side of the equation, then I definitely don't ever want it to be below 30. And ideally I'd like it to be, over 50. So maybe 50 to 100, ideally around 75. It's not a one size fits all question or answer. It really depends on the individual and what their situation is. So, but I never like it to go over 100.
Yeah. So let's say somebody gets their test results, they're low, and they don't have much guidance from their medical doctor. What would be like the top 3 things for people to look at in terms of supplements? And I don't know if you have your preferred type of supplements that you suggest, but what can people do if they know that they're low in iron?
If they're low in iron, well, I think, you got to work to get the levels higher. And that means look at your diet, look at, are you getting enough in? Okay. If you're not getting enough in, you're not going to be able to fix the problem. So there's 2 sides of the equation. It's how much is coming in and how much is going out. Okay. So you have to both be eating it through your diet or supplements and be absorbing it. Okay. So that's the getting it inside of the equation. Are you eating enough? Like, are you a vegan or vegetarian? Because if you are, you're at a high risk for being low in iron. Or if you are just not eating many iron-rich foods, okay? Are you then eating enough food that has iron, but you're not absorbing it? Because then you're still not getting it in. So you could be on a carnivore diet and have a horrible digestive system, no stomach acid, and, all these malabsorption issues in your small and large intestine, and you're still not absorbing it. So you're not getting it in. So that's the side of the equation you have to say, are you getting enough in? Okay. And then the second part of the equation is, well, where is it all going? Do you have a bleed? Are your menstrual cycles too heavy? Like, what's going on here that's causing you to constantly be low? Do you have, an infection in your gut called H. pylori that I see often people get chronically low iron because they're not making enough acid and their stomach is not healthy enough to, be able to help them absorb iron. So I think that's the most important part of that question is, why are you struggling with low iron? Okay. And that part has to be answered. You have to look at the, are you getting enough in and where is it going part? And then, as far as getting the levels up, once you've addressed those 2 issues, you just have to make sure you're getting absorbable iron. Like, I have no problem with people taking iron in pretty high doses to get their levels high. I just want to make sure they're taking a good absorbable iron. And do you have some other issue that's causing you not to absorb it? Like, for example, are you low in maybe copper? Because copper deficient anemia will cause iron deficient anemia because copper is necessary for the absorption of iron. Are you low in folate, vitamin B9? If you are, it's going to be harder for you to be able to absorb iron. So there's just a lot of things that that's where I think a lot of people get stuck, is they're just saying, oh, you're anemic, take iron, but they're not really looking at like the why.
Yeah, totally agree. And to me, if a medical doctor is not asking those questions, then it's on the patient to go and try to get help with either a functional medicine practitioner like you. Here in Canada, we have a lot of naturopathic doctor as well that, we call ourselves the doctor of causes, right? Because we look at the cause of the problem. And if we don't do that, then you're just spinning your wheel and kind of patching, a problem, and you're not doing it the right way. So I think more and more, I find people are starting to ask questions, but at the end of the day, any patient, ourselves included, we have to become our own health advocate and ask the question of the why. And I think if you go at it from that point of view, just sitting back and saying, okay, what's happening? Oh yeah, I'm on antacid, and I've been on antacid for a long time. Therefore, absorption is not good. And there are some tests like the acid organic test or the metabolomics test that people can do that will look at the vitamins and the minerals and to see where you're deficient. So I find, especially here, because it's not part of our system, a lot of people don't even know those tests exist. So I think it's just a matter of having the awareness that there are other tools that are not being used in our typical healthcare system, and that you might have to pay from your own pocket, but you will get better answers to see why is this happening.
Absolutely. And you're going to pay in some form or fashion if you just kind of go along with the process of not getting diagnosed and properly treated, and continue to have a health problem that's just chronically going on because you're not kind of really getting to the root of it. You will pay. You will either pay in the quality and quantity of your life. Mm-hmm. You might not be able to work as much, as long, or as efficiently. Your brain will not be working as well. So you will pay in some form or fashion. It's just a matter of, it might not feel as direct. Just like if you decide to go for the cheap McDonald's meal, you will eventually pay in your health, rather than the more expensive healthy meal that has the high upfront cost.
Yeah. And I find too, fairly new here for us, that patients have access to their portal to see their results. They see their numbers. And, I've had other guests on the show and we talked about lab range versus functional lab range, which are, very different, because the lab range are data from pretty sick people and the functional range are different. So I think it's good that people now have access to the numbers, but if you see that one or two of your numbers in your lab report, it's not good, don't just brush it off. Like if it's liver enzyme that's high, you don't even drink, it's like, okay, what is going on? So I think there's more awareness, and I love the fact that patients have their numbers and they can look, but don't brush it off if one is or two or three are not, making sense, or they're higher range, because the range that they give you is the lab range. It's not even the functional range. So is this a conversation you have with your patients often?
Yeah, absolutely. What I see a lot that is very disturbing is not even talking about functional range, which I agree with you, that's important. But so often the total out of range flagged lab results just get ignored completely, like they're not addressed. It's like, why are you running the test if you're not even analyzing the data and like doing anything with it? And I don't understand that, but it happens so much. And patients think often that if their doctor doesn't say anything, or if their doctor says you're okay, then like you're okay. So I always ask my patients to bring in, their old labs, and they're often shocked when it's like, why didn't they tell me this was out of range? So that's part of the problem, is they're not, addressing these out of range labs. That's not even looking at the functional ranges. Like if we look at the functional ranges, there's so many more people that have issues. The other part of the equation, which is very common here in America, and I'm sure it's common there in Canada too, is that the labs that are being ordered are so minimalistic that they don't give you, like, yes, all of your labs are okay, but we didn't really look at hardly anything, so you're okay.
I mean, that's so often, like somebody will come in and they're all happy to say, oh, clean bill of health, I've got my blood work. And even just looking at the person, they're overweight, they're coming in because they have back issues, they're inflamed and so forth. And I'm like, ooh. And what makes me sad is that it gives them a false sense that everything is okay, and yet it is not okay. So again, I go back to having what I like to call our wellness team, that it's not necessarily just the regular test that is done by the healthcare system. It's having people that can analyze things deeper and go to the source of a problem when you do have a problem. So unfortunately, the resources are there. It's just you have to go in and find them, because you're so right that people, come back and say, oh, my blood work was done. Well, what exactly was tested? And the more we go, the more minimal it is, because our healthcare system is trying to, reduce costs, let's face it. So we're trying to save in places that in a system or a healthcare system is going to cost us tenfold more later. But it's yeah.
It's not saving money. And in Canada, you guys have a large Caucasian population, okay? And I say this because Caucasians are the highest risk for the hemochromatosis genes.
Mhm.
And you guys also, correct me if I'm wrong, but I think you have a lot of people that migrated from the United Kingdom over there, right?
Yeah. Yeah.
Okay, yeah. And Europe. Okay, so the United Kingdom, Ireland, Scotland, England, they have the highest rate of hemochromatosis genes in the world. So if you have, an Irish or a Scottish or an English ancestor, you're at a very high risk. Okay, the French also have a very high rate of hemochromatosis genes, and so do the Spanish, and so do Germans. And all of these European countries, they have a very high rate of these hemochromatosis genes. So you're in a population in Canada where you have a lot of people that do not know that they have these genes that are causing them to increase their iron absorption and put them at risk for hemochromatosis, high iron. And if the government just decided everybody needs to be checked for those hemochromatosis genes, or even just that we are going to force everybody to get thorough iron labs every year, and we're going to make sure that they're in a healthy range, they would save so much money on future health problems.
Yeah, we don't.
Diabetes.
Yeah, we don't even test for vitamin D anymore. You have to ask, and oftentimes you have to pay. So patients don't even think of asking about it. So it just,
Right.
yeah, that's a whole other conversation. So before we wrap up, I know you have a course on the iron curse. Do you want to tell us more about that? So if somebody's listening,
Yeah.
it's like, oh my goodness, I've been struggling with that, or it's a family member and so forth. So tell us how they can get access to that.
So the Iron Curse workshop, you can find it at ironcurse.com. And that is a workshop where I teach as much and all and some additional information that is in the Iron Curse, as far as how to look at the labs, look at the genes, understand the symptoms, understand, what you can do to help correct iron levels. I also have a whole part of the course devoted to anemias and going through all of the different anemias, because if you're going to it's really like you're going to learn a lot about iron. And if you're going to be looking at iron, then you might as well understand the highs and the lows and everything in between. So that's my Iron Curse course. And that's one of my Laborgenomics is a educational program that I created where I have multiple different courses, and the Iron Curse is part of that. I also have a course on brain health, which includes the Alzheimer's genes and some of the Parkinson's and dementia genes, and another course on, well, I have a bunch of different courses, but you can look at all of those at drchristysutton.com.
Okay. And also for people that are interested into digging into their genes, 23andMe, but they can also use your platform if they want to dig deeper into the detoxification. And you probably have a course also on detoxification.
No, so I have a MTHFR detoxification course. I am gonna create a detoxification course. I just haven't done it yet, but I'll do it. So far, all I have is the Iron Curse, brain health. I have one on age-related macular degeneration, a heart health one, a gut one. And in all of them, I focus on, okay, you need to know about these genes, these labs, these symptoms, like these clinical pearls, how to troubleshoot this, and try to make it like as easy and helpful and user-friendly as possible.
You're very prolific, having written all this, because I've written a few books myself. So I know how much work it is and how much you're passionate about this. So thank you so much, Dr. Christy. It was an awesome conversation. Hopefully people will understand both sides of the equation when it comes to iron. Hopefully they go online, purchase the book, and dig deeper into your courses, because at the end of the day, if we have issues, we have to take control of our health, and we have to be our own health advocate, as I was mentioning earlier, and find some resources, because there's so many talented and knowledgeable functional medicine practitioner or naturopathic doctors out there that can help. So thank you so much for your time.
Thank you. Thank you.
This was a fun conversation. So thank you to people for tuning in. Hopefully you learned a lot. And until next week, welcome. I will welcome you back to Hack Your Health with Dr. Nat. Looking forward to another great discussion. Thank you.
Welcome to Dr. Nathalie's 7-day Hack Your Health Challenge. Transform your fitness level with 7 quick, do them from anywhere workouts. Look and feel great. Nutrition. Master the art of optimizing your diet and maximizing nutrient intake with daily nutrition challenges. Biohacking. Unlock exclusive content to tap into your body's innate wisdom. Take on challenges to optimize your mindset and physiology. Ready to transform your health? Visit www.drnat.life to join Dr. Nathalie's 7-day Hack Your Health Challenge. Your journey begins now.
This has been Hack Your Health with Dr. Nat. Tune in each week and uncover simple yet powerful strategies and actionable steps to elevate your health and wellness.